If you suffer from ongoing musculoskeletal pain, the last thing you want to do is, well, anything. There is no shortage, however, of treatment options, physical therapy, medication, surgery, massage, and more. But there's often no simple answer. And as opioids have shown, definitely no magic pill. There is, however, one doctor-prescribed treatment that is proving to help people break the cycle of pain and return to a life full of normal activities.
Pain can feel isolating and debilitating, making it hard to work or connect with loved ones. Many veterans hesitate to seek help, believing improvement is impossible, but you can improve.
Terry served in the U.S. Army and enjoyed skydiving and riding motorcycles. Due to military injuries, he had knee replacements and shoulder injuries. These challenges led to ongoing pain and depression.
I blowed both my knees out on active duty, one in Saudi Arabia, one in the Mojave Desert. I was in pain all the time. Just started getting a toll on me, got really depressed.
Since 2015, RS Medical has surveyed over 25,000 patients who use the RS4i Plus. Results show that nearly half of patients who use it get a 50% or better reduction in pain.
What we've found is when patients are using the device for 30 minutes, they're getting 4 to 8 hours of relief.
As a spine management physician, we have to kind of stabilize pain. So partnering with a company like RS Medical helps me to reduce narcotic consumption and restore function.
Anytime we can add in therapies that are safe and low risk and low cost, we can lower the cost of our treatment and also decrease the complications and the side effects.
It works on a much deeper level than what people would normally expect, and it shows an effectiveness at controlling pain.
After that very first use, I could move my shoulder and there was no pain. The RS has eliminated so much pain that's been in my life. The quality of life has improved 100%. It really has.
For every patient and provider dedicated to enhancing well-being, the RS4i Plus serves as a step forward in that journey of healing and recovery.
I'm joined now by Randy Murphy. He's the VP of Sales and Marketing at RS Medical. I appreciate you being here. What an interesting device. So let's talk about veterans first. It must have had you can see the piece tells us marked impact, veterans and their chronic pain.
Yes, as you know, veterans are most susceptible to having chronic pain, either low back or full, up in their shoulders and their neck. And they're really the solutions that doctors have to solve that problem are medications, surgeries, or ablations. And this offers them an opportunity to be independent from that.
And I'm telling you, the medicines we use, opiates primarily, perpetuate pain. They are not a solution. Mm-hmm. They're very short-term solution and then make things worse overall. So how are we getting these guys off the meds?
Well, first of all, you have to solve the pain from an extreme level to a manageable level.
Yes, how are we doing that? That's what I want to hear.
What happens, your body has its own endogenous opiate system.
I think most people are kind of aware of that, endorphins and
right.
enkephalins.
Enkephalins and endorphins, that's right. And this device is tuned specifically to fire the nerves, specifically A beta and lower motor neurons, to trigger that response. And that happens in the thalamus of the brain.
So the muscles are triggered to contract, and then that sends information back up the brain, and then something's coming back down.
Yes, a combination between that contraction, lower motor neuron firing, and hyper exciting the A beta fibers, which are the things that you feel with.
Yes, and then that goes to the thalamus, and then some fancy opioid or enkephalin suppression's coming downstream.
So downstream will come, first order is a neural inhibitor called enkephalin.
Which is like an endorphin.
It is. It's just a shorter chain peptide.
Yep.
And then with enough stimulation for enough time, you get beta endorphins. And that gives you 4 to 8 hours of pain relief.
And is this something you have to wear every day, or how does that work?
Typically, patients use it 35 minutes. They get about 4 to 8 hours of pain relief. And they'll generally use it in the morning to get functional, and in the evening to sleep better.
And is this available for everybody?
Yeah. And anybody who gets a prescription can get it.
And if you go to your doctor and ask for it, would they know what it was, or do you go online and sign up and then ask for a referral?
Well, as you know, most of the doctors are taught more on the chemical side of the world rather than the electrical side of the world. So we have to do some education, but we have a package that patients can download and hand to their doctor so they can understand it.
And then the doctor just writes a prescription as a form or something goes with it. Oh, I need this. Is it easy to use?
It is. We have garments. You can just put it on your back or zip up a vest with all the electrodes or a shoulder garment, plug it in, turn it on, turn it up, sit back and take a treatment. And it feels good. If you had it on, it feels like you're getting a tactical massage.
Is there anybody who's excluded from this therapy?
Well, anyone who has an implantable, like a pacemaker, obviously we can't interfere with a pacemaker, and you can't draw electricity over metal. Obviously, that's a conductor. So those are our contraindications.
You mean like, again, back to the shoulder, which are my preoccupation, like if I had a metal shoulder in or something?
Yes.
Yeah. Shrapnel and that kind of thing too?
Yeah, well, it depends on you. You can't stimulate over it.
Right. Is there anything we've left out? Is there anything you want people to know about this?
No, just that it's available to anybody, and that it's a good first order to try before trying anything else, because everything else has its side effects and this does not.
And again, it's not just for VA patients, it's for everybody.
For everybody.
Well, congratulations. I appreciate you being here, and
Thank you.
Appreciate the device. For more information, visit rsmedical.com. Stay tuned for more healthcare solutions coming up next.